Hello guys, this is Jacko from MuddyTigerOutdoors, and today you're joining me in the bathroom, but we're not going to do anything nasty or gross or anything like that. What we're going to do is I'm going to show you how to properly clean and dress an injury. In this particular case is my toe, and this is the way I do it. This is not necessarily the way it should be done. This is the way I've been taught to do it, and this is the way that it works for me in a clinical setting. So the scenario is this: I have a toe, not necessarily an injury, but an incision that was sewn up, and this was professionally done. So I had a little bit of a procedure in my toe. If you follow the channel a few videos ago, I told you guys that I had a really bad toenail that ingrown into the flesh or the skin. And you know, I've been fixing it at home. I've been trying to dig it out, but sometimes it just doesn't work, the stuff that you do at home. So it was ingrown enough to where it kept bothering me for a couple of months, and I finally manned up and had it professionally fixed. What that entails is basically making an incision along the side of the toenail, cutting part of the toenail out, taking it out or digging it out from where it is ingrown, and then cutting an ellipse shape on that same area, and then digging the part of the skin out that was also inflamed and damaged from the ingrown. On top of that, I had a little granuloma or granular tissue, which was just very tender, bleeding. It was causing a lot of discomfort, even you know, while wearing a shoe. So it was definitely time to take that out as well. So after that, I've been having to do dressing changes on a daily basis, just kind of make sure that everything's clean, that everything is well taken care of, reduces the chance of infection, or reduces the chance of getting necrotic tissue or dead tissue, which is definitely something that you don't want to do. And particularly in this case, because it's a toe, it's the lower extremity, you have to really have or make sure that you have really good circulation, so you know, the healing process is successful. So some of the materials that we're going to use is a little bit of athletic tape. This is fabric tape, and this is 1/2 inch. We're going to be using this type of gauzy, stretchy bandage material. It's a little bit elastic. It's not your regular Curlex or tighter knit, stiffer gauze. Some 4x4 gauze pads, and these are non-sterile. They don't have to be sterile. Some triple antibiotic ointment. We're going to be using this that is called Zero Form, and basically what it is, it's a little bit of gauze saturated with Vaseline-like substance, and it's sterile, so it just kind of prevents the dressing to stick onto your skin or to the blood, to the dry blood if you have dry blood. And it's very, very good for cuts, lacerations, or if you have sutures. In this case I do, so definitely a good thing to have. And you can find this, I'm sorry, it's upside down. You can find this in any kind of medical supply store, not necessarily in the pharmacy. Some pharmacies may have it, but you can find this over the counter at a medical supply store. We have some scissors. These are nurse's scissors. You don't have to have these. Just any regular pair of scissors will do. Make sure that they're sharp. And that's pretty much it as far as materials. So let me go ahead and clean and dry my toe, and I'll bring you back in. Alright guys, so this is where I have to give you a disclaimer. If you're easily grossed, if you don't like to see cuts and bruises, if you don't like to see sewn up skin, definitely turn the video off, or just pause the video, fast forward, or just click away from the video, because you know, I know some people are they don't like to see these things. So if you don't like to see these things, there's no blood, but you know, some people just don't like to see such things, so definitely look away. Alright, so that is what my toe looks like after a little bit of cleaning with hydrogen peroxide And I know it looks a little bit gnarly, I know it looks a little disgusting, but that's the way it looks. And it's actually looking pretty good, believe it or not. And I don't know if you can tell, but right there, the sutures, one side is grabbing onto the skin and the other side is grabbing onto the actual toenail, or the remainder of the toenail. This part right here on this side, I would say about a fifth of the toenail is what was taken out, dug out with the matrix or with the base of the toenail from where it grows. That's where all the bruising is, or where it's coming from. That had to be taken out just to kind of prevent future reoccurrences of an ingrown toenail. Alright, so after we let it dry, after it's nice and clean, or as clean as possible, what we're going to do is the antibiotic ointment. So we're going to cut this little corner right here so we can extract it. And we're just going to apply a generous amount of the antibiotic ointment. And this serves two purposes. Obviously, the main purpose is to keep it clean, to keep it from getting infected. It's on an antibiotic ointment, topical. The second thing is also to keep it from getting stuck to the dressing. So it's a two-purpose. And the little red bumps that you see around my toe, that's actually, well, some of them are bruising or bruises from the procedure, and some of it is like these ones right here. That's from a digital block, because you couldn't tolerate this without local anesthesia, so that's where it's coming from. Now the second step would be to apply some of this Zeroform, also to prevent the dressing from sticking. So this is what the Zeroform looks like, and what we're going to do is we're going to grab one of the ends, we're going to pull it out, and it's a big section. So what we're going to do is we're going to grab a section, a smaller section, and we're going to cut that, and that's the piece that we're going to use. So without trying to touch it too much with my hands, I'm going to grab about that much. And we're just going to cut it, put that aside, and very gently we're going to cover the incision or the area with that. Now this same technique could apply to any injury that you can have with a knife, any deep wound. Of course, medical advice would be the first thing to seek. But if you're out in the wilderness, if you're getting this out of your first aid kit and you can't get to medical attention sooner rather than later, you could apply the same technique just to kind of keep it from getting bacteria inside and potentially getting infected. Now, the next step is we're going to grab some of those 4x4s. Again, these are non-sterile, and what I'm going to do is I'm going to unfold it like this, and then I'm going to fold it lengthwise in half, like that. And without putting too much pressure, I'm just going to lay that over the top, just like that. Kind of like that. Now there are many ways to do this kind of dressing, different materials too, but this is what's available to me. So this is what I'm going to use, and it works just as well. It's been working for the last week. So I'm going to take a second piece and I'm going to do the exact same, but this time I'm going to lay it the opposite way. So now I'm going to go around the toe rather than over the toe, just like this. Not too tight. You don't want to put too much pressure. Because you can potentially cut your circulation or decrease your circulation if that's something that you don't want to do. Again, this is a toe, this is an extremity, so you got to have the best possible circulation that you can. I'm going to take a third piece and I'm going to do the same thing that we did at the beginning, just over the top of the toe, like this, without too much pressure. And we're going to take one more 4x4, so now we have a total of 4x4 gauze sponges, and we're going to do again going around the toe towards the base of the toe. Make sure everything is nice and neat. You don't want anything wrinkled or folded or looking any kind of weird. Just like that. Again, don't wrap it tight. You just want it covering without putting too much pressure or damaging the circulation. Now you can do less, you can do more, it doesn't matter, as long as you have enough space to work with. Now, here's where we're going to grab our little 1-inch elastic dressing. And what I'm going to do is I'm just going to wrap it around, just to kind of hold the 4x4s secure. Now, this is elastic, so it's easy to get it a little bit too tight or tighter than what you really need. So you have to be careful with not doing that, because once again, you don't want to diminish your circulation. I know it looks a little bit bulky, but that's okay. It's protecting the toe as well. So once we get enough to where we feel satisfied, there's enough padding, there's enough material to absorb potential bleeding, we're going to cut it. And then we're going to grab some of that athletic tape. Cut a section, just a section enough to sort of go around the toe. And again, same principles apply. You don't want to get this too tight, just enough to secure that loose end of the dressing. And that feels pretty good. That doesn't feel too tight. It's not a super neat job as far as dressing goes, but it's definitely doing the trick. Now, you could apply this same technique to fingers, bigger limbs, feet, hands, elbows, knees, just slightly different. Going around toes is a little bit tricky because obviously, it's a smaller area, but that's usually how it's supposed to look. Well, guys, that's pretty much it as far as dressing, or the way I do dressing on a toe in this case. This is not meant to be medical advice. This is not meant to tell you how it's supposed to be done. It's how I do it, and it's how it's been working for me. And once again, this is how I do it in a clinical setting. So if I could give you any advice, is anytime you have something like this happen to you, make sure you seek professional help. Go to your doctor. Go to your orthopedic doctor. In this case, that's what I did. And make sure you get taken care of. It's very, very easy to get this dirty, get an infection. All kinds of bad things can happen if you don't seek medical help or professional medical help. So anyway, guys, I hope you liked the video. I hope you learned a little bit of anything, or at least get a little bit of entertainment out of it. Don't forget to like the video. Don't forget to leave a comment. Please check us out on Facebook, Muddy Tiger Outdoors, and we'll see you guys in the next video. Take care.